So guys, in this section, we will talk about the ventricles of the brain. So first we're going to start with the orientation part, that what ventricle is located in which part of the brain and which cavity they are derived from. And then we will also talk about in detail about the boundaries. In this section, I particularly will take care of the lateral ventricle and the third ventricle. Now, as you can see, this here is the lateral ventricle, which is having all these extensions. Now, this part of the lateral ventricle is called as the body. This here is the body of the lateral ventricle, and we have this anterior horn extending into the frontal lobe, the posterior horn which is extending into the occipital lobe, and this is the inferior horn which extends into the temporal lobe. This lateral ventricle is connected to the third ventricle, and it is connected to the third ventricle via this interventricular foramen. There is an interventricular foramen which is connecting the lateral ventricle to the third. And the third ventricle then in turn is connected to the fourth ventricle. Now look at this, this is the fourth ventricle, this we already said is a third. The fourth ventricle which is situated between the pons and the cerebellum. You can see the pons anteriorly and cerebellum posteriorly, and in between them, the major chunk of the fourth ventricle is between these two. And how they are connected to each other, that is third and the fourth ventricle, they are connected by this cerebral aqueduct. This is called as a cerebral aqueduct, also called as aqueduct of Sylvis. So this is just an overall idea about that where the ventricles are located. Like you can see, the lateral ventricle is located in the cerebrum, so it is a cavity of the telencephalon. The lateral ventricle is the cavity of telencephalon. Third ventricle, which is situated between the thalamus, it is actually the cavity of the diencephalon. And fourth ventricle is the cavity of metencephalon. It is present between pons and cerebellum, so it's a cavity of metencephalon. So guys, what is the best possible section to understand the boundaries of all these ventricles? Now first, we start with the lateral ventricle. Because lateral ventricles are present in both the cerebral hemisphere, so sagittal section here won't help. We have to take a coronal section so that we can see both the lateral ventricles side by side and can appreciate all the boundaries. But for remaining two ventricles, that is third and the fourth ventricle, which are in the midline, you take a mid-sagittal section, and that can help you understand those boundaries of those particular ventricles. So I'm going to start my discussion with the lateral ventricle here. Let's understand the lateral ventricle by taking a coronal section. So here we have the coronal section of the brain, and what you can see in this coronal section, that both the lateral ventricles are exposed. Here we got the two lateral ventricles, and the third ventricle can also be seen situated between the two thalamus. So let us talk about the boundaries which are forming the walls of the lateral ventricle. So I'm going to zoom in this picture. Let us discuss it on the image, and then we'll also draw this coronal section so that you can also take down the notes. So there we go. Here is the lateral ventricle. See, what is forming the boundaries of lateral ventricle? In the roof of the lateral ventricle, you can clearly see this is the largest commissural fiber which is forming the roof of the lateral ventricle, and that is nothing but the corpus callosum. I'm writing everything in short because anyways we have to draw it again. So this is corpus callosum forming the roof. Medial wall is by this thin septum. Look at this septum which I'm pointing at. This is called as septum pellucidum. It's a septum pellucidum. It's a very pellucidum. It's a very thin, translucent septum. That's why the name is pellucid. The pellucidum word stands for translucent. And below the edge or lower edge of the septum pellucidum, you can see the columns of the fornix. These are the columns of the fornix, or more precisely the columns of the fornix, which are running anterior-posteriorly. So when you take a coronal section, what you will see that the columns of the fornix will look like the two nail heads. They look like a rounded body just below the edge of the septum pellucidum. So we got corpus callosum forming the roof, and we have the septum pellucidum as well as the fornix, which are situated toward the medial side or contributing to the medial wall. Now rest everything here that you see, they are all forming the floor of the lateral ventricle. Now starting from the lateralmost structure here, guys, this is the caudate nucleus. That is a caudate nucleus, and to be more precise, it is the body of the caudate nucleus. We got the thalamus in this part here. This is the thalamus, which you can see is forming the lateral wall for the third ventricle as well. But for the lateral ventricle, it is forming the floor. So we got a caudate nucleus in the floor. We got the thalamus in the floor. You can also see a vein here. This vein is called as thalamostriate vein. Thalamostriate vein situated between the thalamus and this caudate nucleus, that is thalamostriate vein. And you can also see this white matter bundle which is running from the amygdala anteriorly. It's a major output of the amygdala called as stria terminalis. That is stria terminalis. It's a major output for the amygdala called as stria terminalis. You will see it running on the thalamus. And lastly, if you can see it in this section, let me just enlarge it for you for one sec. Look at that. Can you see in the floor here some roughened structure here? This is nothing but the choroid plexus. So guys, even choroid plexus is also contributing to the floor of the lateral ventricle. So this section tells you the boundaries of the lateral ventricle, which we're going to draw it in the next part. So we got a roof which is by the corpus callosum. The medial wall is by the septum pellucidum. Just below the septum pellucidum, you can see these two columns of the fornix, which are also contributing to the medial wall. And then majority of the structures are present in the floor. Starting from very medial side, if I go, so we have a choroid plexus, then we got the thalamus, the thalamostriate vein, we have this stria terminalis, and then most cranially in the floor, you will see the caudate nucleus, the body of the caudate nucleus also contributing to the floor. So let us draw this section as well so that you have it in your notes with you. Let me do it on the side here. So we said we are discussing the lateral ventricle, and the section we're going to consider is the coronal section. We're going to take a coronal section. So when you take a coronal section, you will realize that this white matter bundle running from one cerebral hemisphere to the other, the largest commissural fiber, that is corpus callosum. Let me keep writing these boundaries for you. This is corpus callosum. Just below the corpus callosum, a thin sheet that is called as septum pellucidum. This is septum pellucidum. Below the septum pellucidum, here we got the columns of the fornix. The columns of the fornix. So the two structures forming the medial wall, the septum pellucidum and the fornix. And regarding the floor, if I start like this is the thalamus here. We got the caudate nucleus. We have the vein that is thalamostriate vein, and then this stria terminalis. Also, the choroid plexus that we said, which is extending from the floor of the lateral ventricle to the roof of the third ventricle. So these are the structures which are contributing to the walls of the lateral ventricle. So here is the body of the caudate nucleus. Followed by the stria terminalis. To remind you again, the major output of the amygdala, the stria terminalis. The vein that is thalamostriate vein. Then we got the thalamus itself. And here we got the choroid plexus. That's the choroid plexus. All present in the floor. Floor is the most important. Be it lateral ventricle, third ventricle, fourth ventricle, you will see the questions are usually targeted to the floor of the ventricle. So floor is very, very important here. It's by all the structure which we have wrote here. So this is a section in which we talked about the ventricle, the roof, the medial wall, and this whole thing is the floor. The next ventricle that we're going to talk about is the third ventricle, and at least from this picture we can make out that the roof of the third ventricle will have a contribution by the choroid plexus, or you can see the tele choroidae, or you can, another way of calling it, that a pyometra stretching between the two thalamus. It all means the same, right? And the lateral wall, you can see clearly it is by the thalamus. The lateral wall will be by the thalamus. But there are many other things in the third ventricle to be discussed. Well, coronal section is not very helpful when it comes to the third ventricle. You got to take a sagittal section so that we can clearly see all the structures forming the boundaries here. So guys, I'm going to discuss the sagittal section of the brain here, and with the main focus onto the third ventricle. So here is the sagittal section you are looking at, and in this sagittal section, right now our concern is not to discuss the cerebrum. We will be looking at this middle part where we have all the ventricles situated. So if in this low magnification I can tell you this here is the lateral ventricle, this portion here is the third ventricle, and which is connected to the fourth ventricle, that is by the aqueduct of Sylvis. So because we need to discuss the third ventricle, so let me enlarge this image and bring it the third ventricle closer. Guys, look at the portion which I'm highlighting here. This precisely is the lateral ventricle here. So look at the portion which I've highlighted. This is the third ventricle. The portion which I've highlighted here is the third ventricle. So what structures are forming the boundaries of this ventricle? Now what is this, guys? This is corpus callosum, and this here is the anterior most part, that is the genu of the corpus callosum, from where we have the rostrum. And what you'll see just below the rostrum of corpus callosum, we have this a commissural fiber called as the anterior commissure. Once again, I'm writing in short only. That is the anterior commissure. It is called as the anterior commissure, present below the rostrum of the corpus callosum. Below anterior commissure, you can see another very thin sheet of gray matter extending from the anterior commissure to the optic chiasma, and that is called as lamina terminalis. That is lamina terminalis. And one thing also you can appreciate from this picture, look at this, the where I'm pointing at. This here corresponds to the column of the fornix. So once again I can say the fornix, and again more precisely the column of the fornix, the anterior column of the fornix is also there and contributing to the anterior wall of the third ventricle. Now this is the third ventricle, and you can see the anterior wall is by the fornix, by the anterior commissure, and the lamina terminalis in that sequence. Coming to the posterior wall, now what part of corpus callosum is this? This is the largest or the thickest part of the corpus callosum, called as the splenium. And just below the splenium, you can see this gland here, that is a pineal gland. So clearly pineal gland, this is the pineal gland here, is present in the posterior wall. And in the inferior lamina of the pineal gland as well as in the superior lamina of the pineal gland, you will see some commissural fiber there as well. Like in the superior lamina of the pineal gland, we have the commissural fiber called as habenular commissure. We got a habenular commissure there. Whereas in the inferior lamina of the pineal gland, we got the posterior commissure. Commissure. Corpus callosum, as we already discussed, it is the largest commissural fiber. But corpus callosum still is not able to connect everything in the two cerebrum. So we have some additional commissural fibers like anterior, posterior, habenular, hippocampal commissures. So in the posterior wall, you can appreciate the habenular commissure in the superior lamina of the pineal gland. Then we got a pineal gland itself, and in the inferior lamina of the pineal gland, we got what commissure? That is posterior commissure. So these are the three major things that you see forming the posterior wall. What else? What is this, guys? The one which connects the third and the fourth ventricle, that is the aqueduct of the sylvis. So aqueduct also is contributing to which wall? The posterior wall. Habenular commissure, pineal gland, posterior commissure and aqueduct. The four important structures you got to remember are present in the posterior wall of the third ventricle. Roof and lateral wall. We already saw it in the previous section. I'll come back to that. But before coming to the roof and the lateral wall, let us come to the most important part here, and that is the floor. As I already said, floor, be it lateral ventricle, third or fourth ventricle, floor is the most important. And before we discuss the floor of the third ventricle, I want to take your attention to something else which we discussed in the brainstem. Now, may I ask all of you to have a look at this section of the brainstem, guys. You are looking at the ventral aspect of the brainstem here. This is the ventral aspect of the brainstem, and let's only concentrate onto the interpeduncular region. That is the interpeduncular fossa, right? And just look at the structure which I am putting it in this dotted line here. Look at all these structures which I am putting it in here. What that includes, guys? Let me just bring it even more close. There we go. So we have an optic chiasma here. That is optic chiasma. Followed by, then you have this infundibulum or the stalk of the pituitary. Then we have a tuber cinereum. These are mammillary bodies. That is the mammillary bodies, if I write M for them. And we also have a gray matter region here which is perforated by the branches of posterior cerebral artery. We call it posterior perforating substance. I repeat again, this is what? Optic chiasma. Then we have the infundibulum or the stalk of pituitary. Followed by, we'll have the tuber cinereum. We got mammillary bodies, the component of limbic system, the mammillary bodies, and then we have this posterior perforating substance. Now, if you're thinking why I'm telling about the interpeduncular fossa, because we are discussing third ventricle. See, when you see the brainstem from the front, all these structures that I highlighted there, they are in the interpeduncular fossa as a content or as a boundary. But when you see it from inside, when you see it from the other side, exact same structures are forming the floor of the third ventricle. Now, do remember the sequence that you're looking at here. You can see the optic chiasma followed by the infundibulum, then we have mammillary body, and then we have posterior perforating substance. And let me take your attention back to this image we're talking about, where we are looking at the sagittal section through the third ventricle. I hope you remember those structures, guys. Anterior to posterior. What is the most anterior thing in that? That was optic chiasma. Here we go. That is optic chiasma. Followed by, that is infundibulum. I'm writing all in short. That is infundibulum. Followed by the tuber cinereum. I'm just writing TC here. That is tuber cinereum. Then look at this. This clearly is what? That is mammillary body. And behind mammillary body, look at this area which is perforated by some arteries called as posterior perforating substance. That is posterior perforating substance. So optic chiasma, infundibulum, tuber cinereum, mammillary body, posterior perforating substance. Yes, clearly they are all forming the floor of the third ventricle, including one more thing, and that is this. What is this, guys? What is this? Which part of the brainstem is here? That is midbrain. And if this is midbrain, you can see the portion which is dorsal to the aqueduct. This is the tectum of the midbrain, and this here is the tegmentum of the midbrain. That is the tegmentum of the midbrain. So here we have the most important floor of the third ventricle. Just think about interpeduncular fossa. Starting from optic chiasma, whatever structure you saw in the midline, barring third nerve. Third nerve was there in the interpeduncular fossa, but it is not forming the floor of the third ventricle. So we got this optic chiasma followed by the infundibulum. Let me point it out. Here we have the tuber cinereum, mammillary bodies, posterior perforating substance, and that is the tegmentum part of the midbrain. If you simply say midbrain, that will also do, is also contributing to the floor of the third ventricle. We'll draw this section as well, but once again, let me point out few more details in here. Remember we said that lateral ventricle is connected to the third ventricle by this interventricular foramen. That interventricular foramen is very much in the anterior part somewhere here. This is the interventricular foramen, this point here. And this is the beginning of the aqueduct of the sylvis. Now, if I draw a dotted line, there is a sulcus that you will see extending from this interventricular foramen to the aqueduct of sylvis, which is telling you how the CSF will flow from the lateral ventricle through the third ventricle and into the aqueduct. Above this sulcus, guys, let me just give it a different color here. Above this sulcus, this portion is actually thalamus. And below we got hypothalamus. This here is the thalamus and that is the hypothalamus. So that sulcus that you see, this sulcus that you see extending between the interventricular foramen and the aqueduct, that is called as hypothalamic sulcus, and that is separating the thalamus and the hypothalamus. So another thing which is very clear from this picture, that the lateral wall which we saw in this image is by the thalamus. It is not only by the thalamus, it is also by hypothalamus as well. Lateral wall of the third ventricle is by the thalamus, and when you see the sagittal section, you can see even hypothalamus is also contributing to this. In fact, all the structures that you saw in the floor, they are the extension of hypothalamus only. Be it infundibulum or tuberosilium or mammillary bodies, they are extension or the part of the hypothalamus itself. And roof, as we already discussed, roof is by what? It is by the pia mater stretching between the two thalamus, or you can say the choroid plexus that you saw projecting from the third lateral ventricle into the third. So let's draw this section as well so that you have it in your notes. I'm going to do it on the side. So guys, we're going to draw the sagittal section to understand this third ventricle. So when you take a sagittal section, this here is the corpus callosum, the one we said the largest commissural fiber, right? That is a corpus callosum. Below the rostrum of the corpus callosum, that is the anterior commissure, an additional commissural fiber present below, just below the rostrum of the corpus callosum, followed by lamina terminalis. Let me write it for you. That is anterior commissure, and that is lamina terminalis, which is also there in the anterior wall along with the column of the fornix. If this is how the fornix is coming, so you will see this anterior column of the fornix as well. So these are three structures that you will appreciate contributing to the anterior wall of the third ventricle. From anterior, if I go to the posterior, as we said, below the splenium of corpus callosum, we got this pineal gland having superior and the inferior lamina. That's the superior lamina of the pineal, and that is the inferior lamina of the pineal gland. And then you can see it is extending downward through the aqueduct and leading to the fourth ventricle. This is the superior lamina of the pineal gland, which is holding habenular commissure. The habenular commissure. The pineal gland. Posterior commissure. And then this aqueduct. The four important things that you should know contributing to the posterior wall. Contributing to the posterior wall. Roof, as we can see again here, roof is again by the fornix. It is by the fornix, and not only by the fornix, the choroid plexus which can be seen below the fornix here. That is the fornix and the choroid plexus. You can see them in the roof as well. And then comes the most important, that is the floor. Just think about that view of the brainstem from the front and you'll get the answer to this. Starting with the optic chiasma, infundibulum, mammillary bodies, and let's say if this is a brainstem here. So we got this optic chiasma, infundibulum, tuberous cinereum and mammillary bodies. I'm writing them together. That is tuberous cinereum and mammillary bodies. We got posterior perforating substance, and this obviously here is the tegmentum. Tegmentum of the midbrain. We're just using a different color to highlight the floor. The floor, very, very important floor. The structures which were related to the interpeduncular fossa, except the third nerve, optic chiasma, infundibulum, tuberous cinereum, mammillary body, posterior perforating substance, and tegmentum. So this here is the third ventricle. Let us draw that hypothalamic sulcus also, which is extending from the interventricular foramen to the aqueduct, and you see the thalamus above and hypothalamus below contributing to the lateral wall. This is about the boundaries of the third ventricle.